Today is Sunday, 8th of June 2025, 6 a.m. Eastern Time. This science and technology update is brought to you by Preeti Capital, your trusted source for intelligent insights.
Okay, let's picture this. You or someone you know, maybe there's a bad accident or they need urgent surgery.
Yeah.
Time is just critical. They need blood, like right now.
hmm
But there's a problem, the delay. Maybe they're scrambling to find the right blood type or, it's just not there, not in stock.
It's a really scary thought, isn't it? That dependence on matching blood types, on enough people donating, it's a huge challenge everywhere.
Yeah, it's this sort of fundamental limitation in how we do transfusions now.
Absolutely. You've got the ABO system, the RH system.
Mm,
It all means every single time you need that careful match.
which takes time.
Exactly. And it creates these bottlenecks, these delays that in an emergency, well, it can be life or death.
Right. It's not just about any blood. It's got to be the right blood. But what ifs? What if that whole problem, that biological compatibility thing, could just go away?
Mm.
Imagine a universal supply,
Mm.
always ready, always compatible for anyone.
Well, that's the potential breakthrough we've been looking into in the sources for this deep dive.
Yeah, a really interesting science and tech update about universal artificial blood.
From Japanese scientists, right?
That's right. So our mission today is to really unpack this, look at the source material, understand how it might work, what it could mean, why there's so much buzz around it.
It sounds potentially revolutionary.
It really does.
Okay, so let's start with the why. We mentioned blood types, but what makes traditional transfusions so tricky? Maybe even dangerous sometimes.
It's all about antigens. Think of them like tiny ID tags on your red blood cells.
Okay.
If you get blood from someone with different tags, ones your immune system doesn't recognize.
It's attacks.
Precisely. It sees it as foreign and launches an attack.
Mm.
That's called a hemolytic transfusion reaction. It's incredibly serious, can even be fatal.
Wow. So that whole matching process, it's not just red tape, it's literally stopping your body from attacking the help it needs.
Exactly. And it takes time you might not have.
Right. And besides the matching delay, what are the other big hurdles the current system faces? Oh, there are quite a few. Blood shortages are a constant worry globally. Supply just depends entirely on volunteers donating.
And that fluctuates, obviously.
It does. Then there's shelf life. Donated blood usually only lasts about, 42 days?
Something like that, yeah.
And it needs careful refrigeration, strict temperature control. That's tough logistically, especially, in remote places or areas without great infrastructure.
hmm And there's always that tiny risk, even with all the screening, of infections being passed on, right?
Yes, although screening is very good, the risk isn't zero. So you add all that up, it's a complex system, kind of fragile sometimes.
Okay, so that sets the stage. Now, this universal artificial blood idea, the core concept is to just sidestep all of that.
That's the goal, yeah. To create something artificial that works for anyone, no matter their blood type. No need for that ABO or RH matching.
And how does it do that? What's the trick?
Well, the key is engineering it to be antigen-free. If it doesn't have those specific ID tags, those antigens, the immune system just doesn't react. It doesn't see it as an invader.
Clever. Okay, so it's not blood. What's actually in it?
Yeah.
The sources mentioned a few different things being tried.
Right. There seem to be a few approaches. One uses something called hemoglobin-based oxygen carriers, HBOCs.
Hemoglobin, that's the oxygen-carrying part of red blood cells.
Exactly. So HBOCs are basically modified versions of that molecule designed to carry oxygen but without needing the whole cell structure around them.
Okay. And I saw something about perfluorocarbons, PFCs.
Yeah, perfluorocarbons, those are synthetic chemicals. They're really good at dissolving gases like oxygen.
Ah, oh,
So making emulsions with PFCs is another way to create a liquid that can ferry oxygen around the body, kind of mimicking what blood does.
so like different engineering paths to the same result, carrying oxygen.
Pretty much. The aim is oxygen transport, but also, crucially, other blood functions like clotting.
Right, clotting is vital.
So sources mention using synthetic hemoglobin, basically lab-made oxygen carriers, and also artificial platelets.
Platelets, the clotting factors.
Yeah, those tiny things that stop bleeding. So these artificial versions try to copy that function too.
Interesting. And what about these synthetic vesicles and lipid membranes?
Yeah, that sounds like part of the delivery system. Some designs might use tiny artificial bubbles or vesicles to maybe hold the oxygen carriers. And the lipid membrane, that fatty layer, the sources suggest that helps with stability. Makes it last longer, maybe?
Makes sense. Build something robust.
Exactly. Something that can last outside the body and work inside it.
Okay, so engineered components, no antigens, designed to carry oxygen, help clotting. What are the really big advantages here? What potential impact are the sources pointing to?
Well, the most obvious one is speed in emergencies.
Right. No matching needed.
Exactly. Think trauma centers, battlefields, disaster zones. Getting blood in fast is critical. This just removes a massive delay.
It really could change those first few minutes of critical care,
Totally. And of course, it eliminates that risk of the hemolytic reactions we talked about.
which makes it inherently safer in that regard.
Definitely. Patient safety gets a big boost. Then there's the supply issue.
Yeah. Manufacturing it.
Right. If you can manufacture it, you can potentially standardize production, scale it up. That could seriously reduce the reliance on human donors, stabilize the supply chain, maybe even end chronic shortages.
That's huge. Going from a donated perishable thing to something manufactured, the logistics must change completely.
Oh, massively. The sources talk about a much longer shelf life than donated blood.
Longer than 42 days.
Potentially much longer. And critically, some sources even mention it might not need constant refrigeration.
Wow, no cold chain.
Imagine storing it in ambulances, helicopters, remote clinics easily. That kind of flexibility, building up strategic reserves anywhere, it's a game changer.
And the infection risk we mentioned.
Gone, because it's synthetic, not coming from human donors.
Okay, so safer, more reliable supply, faster to use, easier to store. Is this purely for emergencies or
Emergencies really highlight the benefits, but no, the sources suggest it could be used in routine surgeries too, anytime a transfusion is needed.
makes sense? If it's always available and always compatible, it simplifies things for hospitals across the board.
Right.
Now, this all sounds amazing, almost like science fiction. But where is this technology now? Is it still just in the lab?
Actually, no. It seems to be quite a bit further along. The sources mention successful clinical trials, controlled trials.
Really? What do they show?
Well, they reportedly showed it was safe and effective, good results for stability, for actually delivering oxygen in the body, and really importantly, minimal or no immune response.
So it didn't trigger that attack reaction.
Apparently not. The report suggests it performed, comparably to natural blood in these specific test settings.
Performing like real blood in trials.
No.
That's a major step. So what happens next? How does it get from trials to, say, an actual hospital setting?
The next big hurdle is regulatory evaluation, getting approval from health authorities.
Like the FDA or equivalent bodies globally.
Exactly. That's the crucial phase before it could be widely used.
And looking beyond that, assuming it gets approval.
Then the focus shifts heavily onto scaling up production, making large amounts reliably, and also conducting even bigger, more extensive clinical trials.
More data needed.
Always. Need to confirm safety and effectiveness across lots of different people, different situations, really ensure it meets those incredibly high standards for widespread use.
Okay, let's bring this back home. For you listening right now, why does this Japanese research matter? How is it relevant?
Well, think back to that emergency scenario.
Yeah.
This could literally remove a major bottleneck, a point of failure that might affect you or someone you love when time is absolutely critical. It could mean faster, safer treatment.
That's a pretty direct personal implication.
Oh, sure. But it's wider too. Think about global healthcare. Places with limited resources, difficult logistics for blood banks.
Hmm.
A stable, easy to store universal blood supply could dramatically improve access to care in those areas. It sort of raises the baseline for medical readiness everywhere.
So the future of medicine you might encounter could be fundamentally different, less limited by your blood type or where you happen to be.
That's the potential, yes. A shift towards a more controllable, universally accessible resource for something as vital as blood transfusion.
This deep dive really underscores how transformative this could be, tackling these long-standing, serious challenges in transfusion medicine.
Yeah, it offers a possible future where getting compatible blood immediately in an emergency isn't a hope, it's just what happens.
Which leaves us with a pretty big thought to chew on, doesn't it?
Mm.
If universal artificial blood does become widely available, a standard tool,
Mhm.
how does that change things? Like our relationship with blood donation in the community? What about global health equity, disaster preparedness? What other questions, what new possibilities does this kind of breakthrough really open up for us?